Evet, Malta parlamentosundan hepinize merhaba. Şu anda dünyanın değişik ülkelerinden milletvekilleri Malta parlamentosunda toplandı ve dünyanın diyabetle mücadelesi için politika üretmek adına bugün Malta parlamentosunda vekillik yapıyorlar. Ben de Türkiye adına buradayım. Biraz sonra yine Türkiye adına diyabetik kişilerle ilgili Türkiye'de neler oldu, neler olmalı, dünyada diyabetle mücadele için neler yapılmalı, bununla ilgili bir konuşma yapacağım. Hepinize Malta'dan kucak dolusu selam, sevgi, saygı. Ladies and gentlemen, distinguished participants, diabetes prevalence in Turkey is increasing at a pace far beyond previous projections. We currently have two nationwide population-based epidemiological surveys, the Turkish Diabetes Epidemiology Studies 1 and 2, conducted by Satman and Yilmaz in 1998 and 2010 on more than 24,000 randomly selected adults aged 20 years and older. During these 12 years, the prevalence of diabetes increased by 90%, a rate twice as fast as the global average and 3 times faster than the European average. According to the data from the Ministry of Health, approximately 12 million people are currently living with diabetes in Turkey. However, our healthcare workforce remains insufficient to meet this growing burden. Turkey has only 1,200 endocrinologists and 1,100 certified diabetes nurses, numbers far too low to manage the nearly 10 million patients currently under treatment. Consequently, the duration of diabetic patient examinations in public hospitals has been reduced to as little as 10 minutes. Multidisciplinary diabetes teams, crucial for effective diabetes management, are still not fully established. There remains a significant shortage of diabetes nurses and dietitians. As a result, diabetes care has largely shifted to family physicians and internists, many of whom face overwhelming workloads. Until 2010, Turkey was among the countries in the first quartile worldwide without a national diabetes program. The initiative titled Diabetes 2020 Vision and Targets for Turkey, launched as a civil movement by the Turkish Diabetes Foundation with support from IDF Europe and WHO Euro, laid out the first strategic roadmap for the national program through 2 comprehensive workshops. Following this effort, the Ministry of Health officially launched the National Diabetes Program. Diabetes education in Turkey is delivered predominantly by nurses, yet their numbers are still inadequate. The Turkish Diabetes Foundation successfully implemented a structured peer education program supported by the World Diabetes Foundation in 23 cities, reaching more than 15,000 people with diabetes. However, because diabetes education is not reimbursed, scaling such programs to wider populations remains difficult. According to IDF estimates, Turkey ranks 10th in the world in the number of people of all ages living with type 1 diabetes. There are approximately 40,000 children and adolescents with type 1 diabetes in our country. Until the year 2000, children under 18 from families without social insurance faced major difficulties in accessing insulin. In response, one of the largest civil diabetes initiatives in Turkey, GAPDIAP, led by the Turkish Diabetes Foundation, with the participation of 34 NGOs, established insulin banks in 15 cities to provide free insulin for children and adolescents in need. Shortly afterward, the government extended full health coverage to all patients with type 1 diabetes under the age of 18. Until 2024, continuous glucose monitoring sensors for children with type 1 diabetes were not also reimbursed, leaving disadvantaged families unable to access crucial technologies. The Diabetes Parliament coordinated by the Turkish Diabetes Foundation since 2011, consistently placed this issue on its agenda. The Diabetes Parliament served as a forum where people with diabetes can directly communicate their challenges to decision makers, including the presidency, members of parliaments, the Ministry of Health, and the social security institutions. It also functions as a civil mechanism for monitoring progress and supporting the implementation of national diabetes policies. Thanks to the persistent public efforts of the Diabetes Parliament, the government agreed to include glucose sensors for children and adolescents with type 1 diabetes under Social Security coverage in 2024. However, reimbursement for insulin pumps remain highly inadequate. Turkey has a national diabetes registry based on ICD-10 classifications, categorizing individuals as insulin-dependent or non-insulin-dependent. While our national diabetes program covers primarily secondary and tertiary prevention, it still requires improvement, particularly in access to modern therapies. People with type 2 diabetes may be exempt from some costs of partially responsible for others, depending on the medications, supplies, and technologies they require. However, newer and more effective treatments such as GLP-1 analogs and insulin, giderek, are still not reimbursed, limiting access to advanced care. Thank you very much.